Hello everyone, I'm Ankit Shrestha, PhD student at Utah State University. Here is a quick glimpse of the beautiful USU campus situated in Logan. Moving forward today, I'll be presenting our research on understanding the behavior, challenges, and privacy risks in digital technology used by nursing professionals. This is going to be the overall flow of the presentation today. We'll start with motivations and prior literature. One of our motivation was the increasing digitization and the electronic storage of patients' healthcare data in the recent years. But we may wonder why nurses? Nurses are the primary medical staff who is responsible for charting patient information and recording patient health condition. They are the ones who deal with the sensitive data of the patients. On this note, there have been multiple works which have shown that information technology has helped the medical staffs provide faster services in healthcare institutions. However, such works have also shown that the digitization has impacted the collaboration between the different medical staffs. To resolve such issues, Zhao et al. Have suggested to reach agreement on data collection and sharing in digital platforms by in-person collaboration among medical staffs before each of their shifts. However, very few prior works have focused on understanding the issues that nursing professionals face with using digital systems at their workplace. We address this gap in our first research question. What challenges do nurses encounter in using digital systems at workplace and how do that affect their professional duties? Next motivation for us to do this study was the privacy in healthcare. Data breach can result in mental anguish, economic threats, and social stigma for the patients, whereas the medical organizations can face lawsuits and financial losses. In this context, prior work has shown that HIPAA regulations, which provide standards for handling patients' data, are not clearly understood by many healthcare practitioners. Similarly, Eilert et al. Pointed out the risk of leaking a patient's identity when the medical staff are not mindful in using online social media and mobile devices in their workplace. However, there is still a gap from prior literature in understanding the privacy risks arising from the practices and behavior of nurses while interacting with digital systems. This motivates our second research question. How could nursing professionals' practices and behavior in using digital systems lead to the risks of privacy leakage in a healthcare organization? Moving on to our methodology, we recruited 16 participants via email, online social media, and snowball sampling. 13 of our participants were female, 2 were male, and 1 did not prefer to reveal their gender. Participants had to be at least 18 years old and working as a full-time professional nurse to take part in our study. We conducted semi-structured interview with our participants over Zoom that lasted between 30 to 60 minutes. The participants were compensated with a $25 Amazon gift card. We conducted inductive thematic analysis in the collected data. So, what are the limitations of our methodology? Our findings should not be generalized to all the nursing professionals in the USA. To do that, we need to do a large-scale quantitative study. We had non-uniform distribution in terms of the participants' gender. However, US Census Bureau reports 91% of the nurses are female. Our distribution is not uniform but is reasonable. And finally, our study is limited to the US participants only. Moving on to the result section, we'll be using some keywords as shown here to refer to the corresponding participant range. Our first theme is digital systems in nursing. Almost all of our participants mentioned about the help received from digital technologies broadly in 3 areas: easier and structured charting, faster and remote communications, and integrated services of medicine. Some of the participants talked about how the abundance of features in medical charting with little or no direct connection to nurses' needs can lead to confusion and user errors. In this code, participant PN14 talks about how they had to put 3 nurses in a single room, 1 for taking care of the patient and 2 for charting because of how overwhelming the charting software was. Many nurses talked about the lack of functionality in their current system. In this code, the participant talks about facing difficulties getting medicine for emergency patients because the system only allowed medicine to be ordered using the patient pan, which was not always assigned due to the urgency of the treatment. Let's move on to the second theme, which is infrastructural and technological barriers. Participants reported that the IT support in their organization were insufficient due to the lack of manpower, unavailability of support, and the inconsistency and slowness in their response. In the quote, the participant club complains about the slow IT support and how it caused delays in their work. Some participants mentioned that they keep the nursing stations and their rooms open so that the patients could easily get access to them. However, there were cases where the patients entered their room without knocking or prior notice. In such situation, patients might get access to sensitive health information, as there may be some paper with important information lying around, or the screen of the nurses may be active. Some nurses also allow patients to access internet from their workstation as a courtesy service in good faith, where they reported concern that allowing such access has inherent privacy risks due to the sensitive healthcare data accessible through their computer. A few of our participants mentioned the open space architecture of their workplace, where the risk of HIPAA violation is high because the patients being attended at one workstation can hear the communication of nurses at nearby stations. There were other concerning privacy risks reported by our participants. We encourage you to read the paper for details. Many nurses mentioned about the inadequate training, which was generic and non-interactive. Here, participant PN5 talks about having only a single day of training, which was generic and didn't help much because each unit uses different features and technologies. This inadequacy in training could be attributed to the gap between the academic preparation and professional practice, which was mentioned by majority of the participants. To understand this gap in detail, we did a follow-up study with nursing faculties. In this study, we recruited 5 participants, 4 female and 1 male, via email invitation to nursing department of several universities. Participants had to be faculty members in nursing department who taught courses on digital system. The interview and analysis were done using the similar techniques as the study with the nursing professionals. From this follow-up study, we were able to identify 2 major contributors. The first one is the lack of collaboration between the nursing schools and the medical organizations. Here, we can see one of the nursing faculty reporting how the hospitals are becoming increasingly hesitant to allow nursing students to perform in the clinical context due to liability concerns. The other cause is the lack of hands-on experiences. In the quote, we can see one of the nursing faculty talking about the realism component and how their students that have graduated have wished to be better in using electronic health record that the prototype in the nursing schools just can't keep up with. As we reported our findings, let us talk about some of these implications. In this section, we have used 3 colors in our figures to separate the findings from the nursing professional study, findings from the nursing faculty study, and their implications. Our first implication is the recalibration of technology and procedure. Our findings talk about the insufficient IT support which needs to be improved by installing feedback mechanisms to gather suggestions and needs of the medical staff. We also reported on the privacy risks due to patient walk-ins and overhearing of nurses' communication by patients. To address this, the nursing stations need to be rearranged to minimize the privacy risk. Further, our findings showed the complexity introduced in getting medicine for emergency patients, which can be simplified by adding override features for nursing heads in case of emergency. Finally, to address the lack of training reported by our participants, the medical organizations can focus on creating contextualized hands-on training that is focused on specific needs of the nursing units, which can also be stored in an online repository for future reference. Our findings led to several other interesting recommendations. You will find the details in the paper. Thank you.